talk about warning signs in pregnancy because it's something maybe we don't talk about enough. Over 700 women die every year, actually, in the United States from complications related to pregnancy and childbirth. And the interesting fact is that we believe 2/3 of these deaths could have been prevented. And so, as Jordan said, you know your body the best, better than anyone. And simply knowing the warning signs to look for will help empower you to share with your friends, to share with your family and your loved ones, and more importantly, to contact your provider. So the CDC Hear Her campaign is really that tool that we're using here at TMC to get out to our greater community on what to watch for and why. And we'll talk more about that in this broadcast.
Great, thank you. We have a short video clip from the CDC website, just kind of introducing the campaign. So let's watch that. It's just a short minute, like 1 minute video.
Sounds great.
Seems like we don't have audio on this, so let me see what I can do about that. Sorry about that, everybody. Here's the website in case you guys want to view these videos or any of the stuff we're talking about today.
He's the one who noticed his mom's face was swollen. They're the ones she confided in about her change in vision and headache that wouldn't go away. He's the one who really listened when she said that something just didn't feel right. When she had chest pains a few weeks after delivery, she's the one who insisted on admitting her to the hospital. Too many women die from pregnancy-related complications each year in the U.S. Death can occur during and up to a year after pregnancy. It doesn't have to be that way. Most deaths are preventable. Know the warning signs. Hear her concerns. You could help save her life. Learn more at cdc.gov/hearher.
Stacy, can you talk with us a little bit about, what is the cause of these deaths and how they present? And then we'll go into some of the signs and symptoms.
Absolutely. I think this campaign is so powerful because I think it isn't a topic that's talked about enough. And before I get into a little bit about what the question you asked, Jordan, I just want to tag on that as we know our bodies best as women, and we can often tell when something doesn't feel right, this CDC campaign, again, seeks to empower not only you, but your partner, those support people in your life, and anyone really who supports pregnant and postpartum women. It may be other birth workers in this community. And it really empowers us to listen, not just to hear, but to truly listen. And when someone tells you something doesn't feel right, it can really help save someone's life. And I think the importance of this is that we think that a lot of the problems that occur to someone who's had a baby happen during pregnancy, but there's some diseases of pregnancy, such as preeclampsia, that can actually affect you up to 42 days postpartum, which is 6 weeks. And so preeclampsia is one of those. We hear from a lot of patients who come into the hospital that I have preeclampsia and I'm delivered and things are going to get back to normal, not understanding that some of those symptoms can persist for up to 6 weeks, or they can occur for the very first time within those 6 weeks of pregnancy. So it always doesn't happen before you come to the hospital. Sometimes it happens after. So some of the symptoms, and Jordan has them on the screen, and I just want to review them with you, are be concerned if you or someone you know has these symptoms who's pregnant or in the postpartum period up to 6 weeks after having a baby. So a headache that won't go away or gets worse over time, dizziness, fainting, changes in your vision. Certainly those are all neurological symptoms that we'd be concerned of and often associated with preeclampsia or high blood pressure in pregnancy. Fever of 100.4, that could mean some type of infection. Extreme swelling of hands and face, thoughts of harming yourself or your baby, That's a key one, because 1 in 4 women can suffer from perinatal mood disorders and postpartum depression. So I think if you can think of who's in your network of friends and family, 1 in 4, that's a significant number. So knowing how to encourage someone to seek help or go with them to an appointment, how important that is. Trouble breathing, chest pain, maybe your heart feels like it's beating too fast. Sometimes it may feel like it's beating too slow. Severe nausea, if you're throwing up and you just can't get that under control. Severe belly pain that doesn't go away. That's more concerning in pregnancy than in the postpartum period, but certainly abdominal pain at any time that is persistent and severe means something. When you're pregnant, if you don't feel your baby moving as much, that's really important. We encourage women who are pregnant to do kick counts at a specific time every day, usually after a meal, after breakfast, or after lunch, and to know your baby's pattern of movement in utero while pregnant. Other symptoms to go through are severe swelling, redness, pain in your leg or your arm, vaginal bleeding or leaking of fluid during your pregnancy, heavy vaginal bleeding or discharge after pregnancy, but certainly any bright red bleeding during pregnancy is also concerning. In overwhelming tiredness, I think a lot of people think, well, of course I'm going to be tired. I'm pregnant and I'm just having my baby. But sometimes when you have this overwhelming tiredness and fatigue, where you just don't want to get out of bed or take care of yourself or take care of your newborn, that can also be associated with some perinatal mood disorders such as postpartum depression or anxiety. So all of these are really important, and we want to share these resources from the CDC. These campaign resources will also be available on our units at TMC for women, for you and your loved ones as well.
Thank you, Stacy. Let's go ahead and share the personal story that we have from Allison Felix. She's an Olympic athlete, and she's going to share with us her personal experience with preeclampsia.
I was so married to my birth plan. I imagined what it would be like, and I studied and I read and I went to classes, and I felt really prepared to have this natural birth. But what I did not prepare for was a scenario where everything goes south. Hi, I'm Allison Felix. I'm an Olympic athlete and a mom, and this is my story. Being my first pregnancy, I was feeling really great. I trained throughout my pregnancy. I was running every day. I was in the pool. I was lifting weights. I felt really strong. So it was my scheduled routine appointment. I was sitting back in one of the rooms waiting for the doctor to come in to see me. And when she did, she mentioned that she wanted to hook me up to be monitored. I started to think, I wonder if this is normal, and I wonder what's going on. And finally, she came back and she said that she had some concerns and she wanted to send me to the hospital for further testing. That's when my heart kind of sank, and I was like, wow, this must be something. I kind of heard of the statistics of Black women being more at risk for complications, but being a professional athlete, I never imagined myself in this situation. At 32 weeks, I was diagnosed with severe preeclampsia. My husband was coming from work and he met me there, and we were sitting together, and the doctor came in, and she just said that things were still concerning and that they wanted to admit me to the hospital. That's really the point where things got scary. Doctors and nurses were coming in and they were concerned. And I remember at one point the doctor rushing in and saying that, we cannot wait any longer. We're going to have to rush you in for an emergency C-section. I am scared, I'm terrified, but I'm not really concerned about myself. I'm just worried about this little tiny baby who, is not ready to enter this world yet. All I was thinking is just, I want a healthy baby. I didn't imagine, not even being able to be in the same room as my daughter, and not being able to hold her until even the next day. And Cameron was in the NICU for a month after she was born. I stayed in the hospital for a while, and I had some complications that come along with preeclampsia. It was just a really scary, tough situation. But I feel so blessed that I came out on the other side of it. There are so many women who do not walk out of the hospital. They are not there to raise their children. I really want women just to be aware, to know if they're at risk, to have a plan in place, to not be intimidated in doctors' offices, and to be heard, to be persistent about anything that does not feel normal, because I know how important it is. I know how scared I was, and I know how I didn't feel prepared or educated. And I don't want anyone else to feel that way. Hear her.
What a lovely video, just hearing her experience. Now, Stacey, she was at a doctor's appointment and they sent her in. Let's talk a little bit about what the plan can be for moms who are, they're not at the doctor's office, they're at home and something feels off, one of those warning signs, or they just have a bad gut feeling. What should they do before when they're at home? And then let's also talk about after they're discharged in their home. They've already had their follow-up, they've already seen their doctor, now they're at home with baby in that postpartum period. Either of those, what should they do if they're not having regular visits? How should they approach the subject of something feeling off? Who should they call? What should they do in that scenario?
Absolutely. That's a great question. And this is such a powerful conversation. So number one, know the maternal warning signs. And if you feel something's not right, or if you're looking after a loved one who has said that something isn't right, maybe they say something feels wrong, or I'm scared, the goal is to listen. Here at TMC, we really believe in respectful maternity care. So really listening and involving the patient in the plan of care. But we want that to carry over not only during admission, but also through discharge. So this information and a lot of training has gone into training our physicians, our nurse leaders, our staff nurses to understand that if someone calls us, how do we respond? Okay. If you feel your life is in danger, we would urge you to call 911 first. If you feel that your life isn't in danger, then certainly we want you to call your OB doctor's office. What we don't want you to do is wait. We want you to call right away. Don't wait to see if you feel better in the morning or later in the evening when someone is home to help you. The goal is to get help quickly. We want to avoid the sense of denial and delay, which can often get us into trouble. I really believe in lifting fellow women up in the community and certainly in healthcare. And the goal is to make Tucson a safer place. And by hoping, the hope is to share this information that this will help save a life.
Right. So obviously, like you said, if it's an emergency situation, call 911, get to the hospital. And then also I'm available as the perinatal nurse navigator. If you have questions about what warning signs are, or you want to know more about preeclampsia, you can reach out to me and I would be happy to have a discussion about that with you. I think, did we touch on everything we wanted to talk about today, Stacey?
Yeah, I think
anything else you wanted to add?
I would like to add that, everyone comes from a different place when they're having a baby, right? You may have blood pressure when you come in, you may not. You may have diabetes when you come in, you may not. But we have trusted expert staff who are willing to give expert, individualized discharge teaching before you go home. Warning signs will be included in your discharge packet if you deliver at TMC. If you're not delivering at TMC, then we urge you to go to the CDC website and get this information, and certainly use us as a resource. And we just, thank you so much for engaging in this important topic that often isn't talked about.
Thank you for sharing with us. Everybody, for next week, we have Dr. Richards. She'll be coming on as a guest speaker. We're going to talk about newborn care and newborn safety once you get baby home. So join us next week, Thursday, the 17th at 11 a.m. And I don't believe we have any questions from the audience. So if you have questions afterward, you can add those and we will get in touch with you to answer your questions. Thank you, Stacey.
Thanks, Jordan. Thanks for having me.